This week's Ask Dr. Durie is about the coronavirus. There has been a lot of concern about this novel COVID-19 coronavirus. Based on the initial experience in China, there has been a lot of anxiety about how potentially dangerous this virus can be. The most important thing for the myeloma patient to be aware of is that this virus can have serious effects in individuals who have a compromised immune system, who are more elderly. For some reason, there is more of an impact, a negative impact in men versus women, which we don't understand yet. There also is more of an impact in individuals who have other medical issues going on. And so, what are the symptoms of infection with this novel coronavirus? Well, the key things to be aware of are that 90% of patients have had a significant fever, 70% have had a dry cough, 30% have had tiredness or just a general malaise. Very few patients have had a runny nose or things that would make you think about either a cold or the flu, 4%. And so it is possible for doctors and healthcare providers to rapidly distinguish between someone who might have the coronavirus infection versus a regular cold or flu. And so what is recommended for patients? Well, the key thing is to avoid exposure. This is not a virus that you want to come in contact with if at all possible. And so what are key steps to try to achieve as little exposure as possible? Well, I have detailed these in a couple of blogs, and I strongly recommend that you go to myeloma.org to access all of the information that we have made available there. Let me identify 4 broad areas where it's important. First of all, what has become a new mantra, social distancing, to stay a respectful distance from others who might potentially be infected. In my recent blog, I suggested tapping elbows or the tips of your shoes, but definitely avoid handshakes. One should obviously also reduce or limit travel of all types, especially on planes. It's recommended that you clean surfaces that you're coming in contact with where there could be a concern about prior exposure. And then, of course, with information being updated and changing so rapidly, it's extremely important to stay up to date. And in my blogs and on the myeloma.org website, we've given a lot of contacts where the updated information is available. And so, bottom line, it is extremely important to avoid exposure and follow the guidance that I'm giving you here and that is more broadly available in the various links that I have provided. If you should happen to develop any symptoms like fever, cough, tiredness, and malaise, please contact your doctor or a medical professional as soon as possible. Also, if you have any concerns about the possibility of having been exposed. So please stay alert, and with the proper precautions, it is feasible to avoid the contact that is of the greatest concern.